Alright, let's break down the best way to heal a broken bone. If you ever find yourself with a fracture, here's what you need to know, straight from science and doctors. First up, you need a proper diagnosis. That usually means an X-ray at a hospital or clinic. Never try to guess if it's just a sprain. Once the break is confirmed, your doctor will set the bone. That means lining up the pieces as close to normal as possible. Sometimes this is done by hand, other times surgery is needed if the break is complicated. Next is immobilization. This is where casts or splints come in. They keep the bone from moving so it can knit back together. Most bones take about 6 to 8 weeks to heal, but it really depends on your age, the bone, and how bad the break is. Now let's talk about healing itself. The body does most of the work. It sends special cells to rebuild the bone, kind of like a construction crew fixing a bridge. Eating a healthy diet helps, especially foods rich in calcium and vitamin D. Stay hydrated and don't smoke. Seriously, smoking slows healing way down. Physical therapy is key after the cast comes off. Moving and strengthening the bone helps it get back to full strength, but don't rush it. Listen to your doctor about when it's safe to push harder. So, which method works best? Honestly, the gold standard is still medical treatment with proper setting, immobilization, and follow-up therapy. All those home remedies online, not a good idea. Bottom line, trust the professionals, eat right, and give your body time. That's the fastest, safest path to healing a broken bone. Stay safe out there.